dimensions that go into that. And one of those very, very, very important dimensions for employers and the employee experience is benefits and their benefits. Wanted to bring in a guest speaker for today's session that is an expert in that area. Her name is Christina Heckathorn,
Heckathorn.
right? Yes, I said it right. Heckathorn. I want to introduce Christina to you real quick. I have a little bio to read about Christina, and then we'll move on to Christina's content. So Christina is an employee benefits advisor with EBA, a Hub international company with 18 years of experience helping employers build smarter, more sustainable health plans. She specializes in alternative funding strategies like level funding and self-funding. And Christina works with organizations to take control of their healthcare costs while delivering strong benefits to their workforce. So we're so happy to have Christina join us this morning.
Thank you, Chase and Ashley. And I'm going to go ahead and start my slideshow and get that sharing. Okay. All right. Did that pop up okay? I
Yes.
can't see you guys. Okay,
Yeah,
thank you.
Sorry, we were giving you thumbs up.
Thumbs up too. Yeah, yes.
Once I start sharing, I can't see you guys anymore. So you'll have to chime in and stop me if you need me to stop at any point, because all I can see is the presentation now. But yes, thank you so much for having me today. And I wanted to talk about navigating the constant chaos of health insurance, because right now it's like the wild, wild west. So on our agenda for today, we're going to hear about the changing health insurance landscape in Kentucky. So what's going on here locally, learn why healthcare is so expensive and the costs are rising with no end in sight, discuss competing interests that are keeping healthcare costs up, alternative options for purchasing health insurance, learning how to deliver better healthcare to employees, and then we'll have a discussion and question section. So we'll just dive right in. So what's happening in Kentucky? Well, as you guys know, a few years ago, we had three major carriers in our state, and that was Anthem, Humana, and United Healthcare. Aetna was trying to make a play, but at that point, it wasn't very competitive. And then all of a sudden, out of nowhere, we get this announcement that Humana is leaving the marketplace. And that was really big in Kentucky because, they had one of their offices out of Louisville, and it was a huge presence in Kentucky. They had quite a bit of market share here, and so when that hit, that was such a huge impact to the Kentucky market and Kentucky businesses. And for a few years, it left us just flailing with United Healthcare, and Anthem. And I wanted to talk about this because, benefits encompasses a lot of things, but right now, health insurance is probably the most hurtful one and most impactful one because of cost rising. Employers are getting double-digit increases here. And one of the reasons why that is because we don't have very much competition in the state. Cigna and Aetna are now trying to make more of a play. We're seeing a little bit more competitiveness out of them over the last couple of years. Anthem is currently holding 85% market share, so they pretty much own the market here. So it just leaves not a lot of room for competition, which is driving cost up. And that is significant to all of you as, if you're a business owner or in HR or in that type of role. All of that is significant to all of us. And, a lot of people are like, why do you work in insurance? Because I hate dealing with insurance companies because I can see this over and over again, but I'm out there. The reason why I do it is because I'm fighting for Kentucky companies and for Kentucky employees, and that's really important. So that's kind of what's happening here in the Kentucky market. And so let's talk about what's happening. So the current model, the problem we have, number one, is that all players within a health insurance plan have misaligned interests, unfortunately. Second problem is that there's no management of the frequency and severity of claims. So if you deal with claims at all or have, see your claims data, there's no management of that. Nobody is out there managing it for you. And, the carriers are just processing these claims and things are getting paid. And then problem number 3, employers are managing double-digit increases by moving to lower cost, high deductible plans, which is affecting your employees because now they're having more out of pocket, they're having higher deductibles. A lot of you, this is probably the strategy that you're seeing. And unfortunately, what's happening is it's making employees functionally uninsured. So let's talk about the competing interests that are out there. So number 1, you have carriers. Okay, so we talked about Anthem, United Healthcare. We call them the BUCAs, which is Blue Cross, United, Cigna, Aetna, and Anthem. And since the passing of the Affordable Care Act, the market value of the BUCAs has increased over 1,000%. I know a lot of you have probably heard of MLR, the medical loss ratio. That was supposed to hold down their profits. And unfortunately, they got really smart. You know, they have shareholders that they have to answer to. And so, how in the world have they gotten to increased over 1,000% in the market? And it's because they laid off a lot of workers. They have increased premiums. But the one thing that people don't realize is that they are processing more claims and they're allowing a lot more to go through. They used to audit a lot more claims, like back prior to the ACA. You probably heard about people being scared that their claims weren't going to get paid. Well, now, pretty much, if you're with Anthem, everything goes through. There are no denial of claims anymore. So the auto adjudication rate's a lot higher. Well, why is that important? It's important because if I'm Anthem and I'm trying to answer to my shareholders on how I make more money for them, I'm going to process more claims because the MLR only allows them to keep 10 to 20%, depending on group size, of how many claims I process. So, of the amount of money that's coming in. So, if I'm processing $10 million in claims, I get to keep like 10 to 20% of that. Well, if I'm processing 100,000 in claims and now I get to keep 10 to 20% of that for, profit, then that's a lot more money. So people don't realize that they're processing more claims and allowing those to get paid. And that's okay with them because they're able to keep more of that money in their pockets instead of having to send it back to groups. The days of the MLR pretty much non-existent anymore. Companies used to get checks back, but now they're not. And it's really sad because the BUCAs have outperformed the S&P 500 and the Dow Jones so much. It's really disgusting. So competing interest number 2 is the pharmacy benefit managers. We've all heard that they are the devil. The large pharmacy benefit managers have 32 different ways that they hide revenue, which is just disgusting. They sell your data. There's all different ways in there. They do spread pricing, all kinds of stuff that's hidden in there. They keep, they'll pay out rebates, but they don't necessarily pay it directly to the client. There's all kinds of shady things going on behind the scenes there. And then last is brokers. And I'm telling on myself here because, I'm a broker, I'm in that role. And unfortunately, brokers are incentivized by large bonus offerings from the carriers, which is designed to manipulate our behavior. What carriers do we place business with? Because we're going to get a large bonus from that. Well, if we're one client away with Anthem from getting a bonus, if we move them to United Healthcare and that changes our bonus structure, that's going to really affect our finances. So keep in mind that brokers are incentivized by these carriers as well. And so it's really important to make sure that you have a transparent offering with all 3 of these. Are you getting transparency from your carrier, from your PBM, and from your broker? Okay. So what's the solution to that? Well, the solution is we've got to peel back the onion, right? Those layers of the onion to see behind the scenes. And that's where alternative funding comes in. So this is the meat and potatoes of today is that you guys should be looking at alternatives. Now, a lot of companies shy away from self-funding, okay? I can tell you that my smallest group that is completely self-funded has 28 employees. They're out of Frankfort, Kentucky. They're a small group. They're a bank. And they have that ability to self-fund. And the reason why they can do that is because they purchase what's called stop loss or reinsurance. That pays for those large claims. And that's all part of the premium that employees will pay. So it's really important to understand that there are financial pieces of the puzzle behind the scene to help mitigate that risk with self-funding. So it really isn't as risky as you think that it is. With self-funded, the employer assumes the financial risk up to a deductible that stop loss carrier puts in place for them. It's not the same deductible that your employees are paying. There's greater flexibility in plan design. With self-funding, you can design your plan how you want it to be. There's actionable data, which is number one. If you have data, you can see exactly what's happening in your group and what you need to put in place. Cost containment abilities, that's the next piece of the puzzle we're going to talk about, is cost containment and how you can design your plan to make sure that employees don't just have an open credit card to health insurance and health plans. We want to make sure that they are getting the best care when they need it and not overutilizing their health insurance if it's not necessary. Lower administrative costs. When you are fully insured, there are so many admin fees baked into all of that that you don't even see. The employer maintains control over their health plan reserves, which is your claims dollars. You're holding that in your account and you're only paying claims as they happen. So in the first few months of the plan year, there's not a lot happening. You're holding that money in your account. You can hold it in an interest-bearing account, but it's your money until it needs to be used for claims. And then you have enhanced cash flow because of that reason. If you are not feeling good, about self-funding, maybe that's not the right option for you guys. You've never done that before. There is an option called level funding. And I'm not talking about level funding with Anthem, which they call balance funding, or with United Healthcare. This is level funding with a TPA, a third-party administrator. It is predictable like fully insured, where you're paying a set monthly amount every month to the third-party administrator, but you get the advantages of self-funding because you are in control of the plan. The only difference between level funding and self-funding is that instead of you holding onto your claims dollars, you're actually sending them to the third-party administrator and they're paying claims as they happen. And then if you go over your month's reserves of what's in that claims fund, the stop loss carrier is funding that for you throughout the year. So you are just paying the set amount every month for each employee, just like you normally would in a fully insured model. You get all the cost savings and you get flexibility in the plan design, just like self-funding. You also get that claims reporting, which is huge. But the nice thing is if you don't spend all the money in your claims fund, you get that back at the end of the year after that plan run out has happened for that plan year, which is awesome. So if you have 400,000 in your claims fund, you pay out 300,000 in claims, you have 100,000 left, that's your money that you get to keep as an employer. And it's a very low risk plan. Next is captives, which takes that even further. So this is employers coming together into a pool, because maybe employers are a little scared of the stop loss, so they'll get a stop loss captive where a bunch of employers are together. You can do self-funded or level funded, but the risk is spread amongst the employers in the captive. So that's nice because then it helps kind of mitigate increases on bad years. They say self-funded and level funded is like the stock market. You're going to have really good years and then you're going to have bad years. It's kind of, you'll have more good years than bad years, again, like the stock market. So it's customizable and it is designed for smaller employers to be able to self-fund or level fund on their own, which is really nice. And last, I wanted to talk about associations, which is like what the KPCA has. Okay, so this is like employers coming together. There's a membership organization that you all have a common interest, right? So primary care, you all come together, you're in a pool. And what this does is it spreads the risk amongst all the employers in that association health plan. So they will rate the association as a whole come renewal, and then they take that renewal and then they spread it out amongst the groups. Now, the nice thing about that is that when you go through renewal, typically they will cap about how much your highest is and your lowest. So you may not necessarily get what you deserve for a renewal because if you're running really well, you may get like a low single digit. If you're running really bad, you may get like close to a 20%. But it keeps you on this little trend so that you can budget better. And that keeps you from having a really high renewal if you were out in the open market. So if you deserved a 50, if you were with Anthem directly versus if you're with, the association, you may get a 20%. So it really helps keep everybody between that 0 and like 20%. Now, the KPCA may be a little bit different from that, but just speaking of the associations that we write for, that's how they operate because a lot of companies, they live and die by their budgets because we sell for the Kentucky Nonprofit Network, the Kentucky Association of Counties, where budgets are so important. And so it's really nice that, if you're running well, you're helping out the groups that aren't. And on the flip years, they're doing the same for you. So it just it makes it way more affordable on those renewals. So that risk is spread amongst all the employers in the association health plan. You get that reduced risk of high year-over-year increases. Small groups are treated like large groups. Okay. So I'll pause for a minute. Any questions on those? Okay, great. All right, so we currently operate, this is one of the problems, we currently operate in a fee for service model. So remember when I was talking about myself being a broker and how we're part of the problem? I try not to be part of that problem, but we're part of that issue that brokers are out there. Well, another problem is on your all's end, and that is that you all operate in a fee for service model. So one of the solutions that companies are being shown is direct primary care. So you guys may have seen this as a model that you are out there competing against. And direct primary care is a healthcare model that provides unlimited access. So it's kind of like concierge, but not as expensive. So employers are actually paying for this for their employees, and they pay that monthly membership fee, and it gives their employees and potentially their families, depending on how much they want to pay for, unrestricted access to their primary care provider. Now, why are they putting this in place? Well, because as you guys know, access to care is becoming so difficult. I mean, we are constantly in this rat race to get to doctors because, our country, and especially in Kentucky, we're just a very unhealthy population. And so getting access to your primary care physician is really difficult. Getting into the doctor can take months. And if you're having acute issues, you have to go to, your local, like, oh my gosh, in Kroger, little clinic. Sorry, I was losing my thoughts there. You have to go to like a little clinic or, one of the clinics that allow for walk-ins, those walk-in clinics. So what some employers are doing is they're going to direct primary care because now employees can get same day access or next day access to the doctors or nurse practitioners. So here in our area in Kentucky, Blue Mine is in Lexington, it's in Louisville, E-Town. They've or have opened in Somerset now. They have a ton of offices and they're nurse practitioner driven. So these are who you're competing out there, and this is what employers are seeing as a solution. And then Olive Health is one that's here in Lexington, which has the Coopers that are pictured in this slide. So you guys are butting up against this just like I'm butting up against, other brokers in the industry. It's a real problem, that lack of access to care. So just know that this is a solution out there for employers that they're using. Rise of the administrator is a big problem. This has created a really complicated system in our country because of all the multiple insurance plans throughout the country. Every one of you have probably had to deal with this with, the people in your office, but the growth of administrators in the United States at these hospital systems has grown significantly, and you can see that on this chart here. And those people get paid really good money. And so how are they getting paid? Well, insurance has had to pay more to the hospitals, and we know that. And that's really, it's not the primary care doctors that are driving up rates on our health insurance plans. It is the hospital systems. And this is one of the reasons, is because of all of the administrators that they have to have, how well they pay them, and somebody's got to pay for that. And it comes through insurance premiums, unfortunately. So what's the solution to that? So we recommend building a healthcare ecosystem. So when we're looking at plans, like, when we talked about those level funded options where you have a lot of options to be able to put in there, or when, if you're doing self-funded plans, a lot of programs can be bolted on those where you can provide imaging solutions. We use Aptiva Health, which you guys may be familiar with. They're here in Lexington and Louisville, Northern Kentucky. They have imaging for orthopedic. And then Green Imaging is another company who has direct contracts with imaging providers throughout the country. So think of like ProScan, Lexington Diagnostic. So if you have these programs built onto your plan, employees can get free care at those locations, which is really nice. So why is that important? Well, one, because we are now taking away, sending people who have maybe a sprained ankle, we need to see if it's broken, if they have a broken bone, instead of sending them to Baptist Imaging, where it's going to cost them up to $1,000 for an image, we now can get that image at a lot less cost to the plan, but be able to provide it to the employee at no cost. So that's a win-win for both the employee and for the employer and their health plan. Another option is around durable medical equipment. Connect DME is a solution that we've used in our plans, and that's really nice because with durable medical equipment, they charge a plan 98% of Medicare. Now, with Anthem, United Healthcare, when they have things coming through the plan, it's typically 150 to 200% of Medicare and even more getting charged to the plan. So when you can source durable medical equipment for 98% of Medicare to the plan, you then offer it at no cost to your employees. So now it's a win-win. So for things that are non-emergent, that they can wait 24 to 48 hours to have mailed to them, this is a great source. To give you an example, with Connect DME, we see a lot of people now getting sleep studies done. Sleep studies are so expensive, but Connect DME can send someone the sleep study equipment to do in their home, so in the comfort of their home. It costs the employee nothing, and it only charges the medical plan $300 for that sleep study. It's insane how much cheaper it is. And then if that employee needs to have CPAP machines and their equipment, they can get that through Connect DME. It's no cost to them. And again, 98% of what Medicare would charge is what would get charged to the plan, which is a win-win for both the employee and for the plan. So you can kind of see where we're going here. We're steering employees to certain vendors, things that we want to make sure that they can get easy access to, things that can make a direct impact on the cost of the plan, but also be no cost to the employees and make them feel like they have a really good option. Diabetes management. Oh my goodness, diabetes is so prevalent right now, and we need to make sure that people are taking their meds, that they're getting counseling for that, that they have access to what they need. Their continuous glucose monitors. So there's a lot of companies out there. One of them, I always like to give solutions because if you're not working with me and you're working with your broker, I want you to be able to take this to them and say, hey, do you know about this company so that they can work with you on these? It's really important. I like to be an open book because we're helping Kentuckians one plan at a time. So Diet Thrive Health is really great. They're one of the options. If a member signs up for that, then they get their continuous glucose monitor, their glucose monitors. All of those are at no cost to them. They get counseling, they get free insulin needles. They don't get their meds through this program, but they get everything else. And there's other options for the meds that we're going to talk about here in a second. But this is crucial because if people are not keeping up with their diabetes, we want to make sure that they have best foot forward always. Because if they don't, they could end up having parts of that, like their toes, their foot amputated, and that is not the goal at all. And so you'll see with everything that we do, we're trying to give access to care so that it does not stop members from getting what they need when they need it. And that is what's crucial. One of the other vendors we use is Second Opinion, so Second MD. That's really important because not a lot of people get second opinions. I had one member who was an HR at one of our companies. He was told by his primary care doc that he was showing in his blood work that he needed to go to an oncologist right away because he was presenting with potential cancer. And this poor HR was freaking out, so upset. That's like a diagnosis you don't want to hear. Goes to the oncologist, and thank goodness the oncologist ran blood work again and he didn't have cancer. So I don't know what was going on in the first set of blood work, but thank goodness they had the wherewithal to run that again and to where he didn't have that. But if he had been diagnosed, second opinions are always important regardless. It's always good to take a second look when you're facing a life-changing diagnosis such as cancer. All right, so the next problem, blockbuster drugs. Oh my goodness, these are amazing drugs, but boy, are they expensive. So, like Humira, I'm sure everybody's heard of that. There's now wonderful biosimilars out, which is great. You know, Yusimary is one, but these cost a lot of money to the plan. If you are a smaller employer under 100 employees, you are definitely going to see a few of these and it can blow up your plan super fast. When you are on a fully insured model, there's nothing you can do about it and your rates are just going to keep increasing year over year. You know, you'll see Skyrizi and Enbrel, sometimes Wegovy, and all these drugs that are out there that are really expensive. Anything you see on TV, super expensive, very necessary, but we can always find solutions around these and how we get members steered to those solutions. So let's talk about those solutions. All right. One is international sourcing. My caveat to tell you is yes, it is illegal to do international sourcing. However, the government has come out and said that years ago, and said that they're not going to police that, and they haven't been. So take that and do with it what you will. But we are always very open and honest about that. But we do have a lot of employers that are accessing international sourcing through like Canada, because those drugs are half the cost than what they pay here domestically. And the members, when they do that, they get it at no cost. Okay, so that's one option. Manufacturer's assistance and copay assistance programs are another strategy that pharmacy benefit managers will allow you to use. Where if someone is, like, say they're taking Humira, and as long as it's covered under the plan, then the manufacturer will give the copay assistance cards to the employee for them to use. Well, once we know that that's happening at the pharmacy level, or when that drug is getting sent out, because a lot of times it's at a specialty pharmacy, the plan will then raise the cost of the drug on the back end to the member, knowing that the member is going to get that taken care of through that copay assistance. So it puts more onto the actual manufacturer to pick up and less on the plan. It's all very legal, a little crazy that all that happens in the back end, but it does. So that's a good strategy. Foundations are another one. If someone's taking, maybe they have a rare genetic disease and they're taking a drug that's $350 to $500,000 a year, you can tap into foundations to help that member to get covered for their drug. So that's another thing. So you could actually exclude it from the plan and then have the foundation help pick that up for the member. There's lots of solutions like that. Generic drug programs. We use one called RX and Go, where members can get up to 1,400 generic drugs at no cost to them mailed to their door, which is wonderful. Now, you can't do that on fully insured plans, but you absolutely can on self-funded and level-funded plans. So generic drugs aren't very expensive, but if you've got members taking 3, 4, or 5 of those, and maybe a couple family members in the household that are doing the same, that are on the plan, that can add up really fast. And, $10, $40 copays times 3 or 4 every single month, that adds up. And with the cost of gas and food, everything, housing rising the way that it is, we need to save the money where we can. So that's a huge program. And then the last one is to use a transparent PBM. So PBMs, like I said, remember, they have 32 hidden ways that they charge these plans that are hidden in their contracts. And that's going to be like your major PBMs that you see, like Express Scripts, Caremark CVS. So transparent PBMs are going to be smaller PBMs that charge instead of doing spread pricing, they'll charge a per script fill fee. So like, let's say $5, $6 per fill that happens. And that way you know exactly how much you are paying per drug instead of this arbitrary number that you really have no idea. So use transparent PBMs. Your broker can absolutely help you find who those are, but their service is a lot better as well for your members than what you'll find in the big 3 PBM space. All right. So another problem is that no one should have to navigate the journey alone. Patients are confused, and the patients in our scenarios are our members, they're our employees, family members of our employees. So when you look at these statistics, 50% of patients are confused, 33% not given post-discharge instructions, 44% hit a dead end and stop. 24% of all physician services are duplicated. I mean, these statistics are staggering. So That's a huge problem because then what happens is that people are not getting the care that they need. And Kentucky, the men in Kentucky, unfortunately, especially in our rural counties, they are so bad for waiting till the last minute. They've got a pain. They wait and wait and wait to get it checked out. No offense to men, you just like this. You know, you don't like to go to the doctor, and they end up going, and then it is something catastrophic that they could have taken care of way beforehand. In everything that we've talked about today, like primary care is so crucial, and we need to have better access to that. And with all of these programs, like to keep people from hitting this problem right here. So, one of the solutions that we have now, I don't know that every broker has access to it, but there are some companies out there that do it, but we have our own company that does it. And that is nurse navigation. We came up with this program because what we found is when we were putting all of those wonderful programs I talked about, like Connect DME and Green Imaging, Diathrive, when we were putting those in place, we would go out, we would talk during open enrollment, tell employees about all these wonderful programs that they had. Well, you and I both know that 6 months down the road, when Sally needs an MRI, she's not going to remember that she needs to reach out to Green Imaging, right? So we needed a nurse navigator. Any customer service person could have done this job, but we wanted someone trusted. And that's who's more trusted than a nurse or a doctor, right? So we have nurse navigators. Our nurse navigators are integrated into the health plan. They walk along patients with their healthcare journey. They are accessible. They are experienced. They do not do anything clinical. That is not their purpose. Their whole purpose is to steer members to high quality oncologists, specialists, and then also to steer to those programs for the members to be able to access the free care for them if they choose to. Everything is voluntary, no matter what broker you're working with. All these programs are all voluntary programs. But it's really important to understand that, if we can get this information in front of the members when it matters, it's crucial. So here are some of the things that they do. Drive utilization of those plan solutions, help reduce the out-of-pocket expenses, find high-quality specialists, and help choose facilities that deliver high quality of care. This is crucial because employees are so confused and they stop. We want to make sure if we're going to an oncologist, are we going to the right oncologist? If we're going to an orthopedist and maybe we need knee surgery, we don't want the orthopedist that's really good at shoulder surgeries. We want the one that's great at knee surgeries, right? So they have access to software that tells us quality scores. It doesn't for primary care, so don't worry. It's all for specialists and to help make sure that they're getting to high quality specialists. So that's really important. So we have gone through a lot of information, and I'll tell you, like all of these solutions are things that you can work with your current broker on. For the KPCA Association Health Plan, they actually work directly with a specific broker. So if you are not currently on that plan, I absolutely implore you to get quotes for that. And you are going to go through a company called Houchins. If you're not sure how to get in touch with them, get with the KPCA. I'm sure on their website they've got links to how you can contact Houchins, which is Houchins Insurance Group, and they can get those quotes for you. But definitely explore all these options. If you haven't been exploring them, it's really important that you do so because with double-digit increases year over year, none of us can sustain that. No companies can sustain that unless you just have a lot of money coming out your ears. So, with that, I'd love to stop the presentation and see if anyone has any questions or talk about what has or hasn't worked for you all. All right, I can see you guys again. So Jessica, oh, we've got some more people on here. Sherry, has anything specifically, I think Sherry, are you guys on the KPCA plan? Which she's,
And
yep, there we go.
yes, I think so. Evgenia, who is on here, is actually my co-partner, and she's in charge of benefits here. So
Oh, perfect.
Evgenia might be able to speak to that a little bit more.
I don't have anything really to say about it. Yes, we are part of KPCA. It's for first time.
Mm-hmm.
Um, we're still learning how to work as a group, and through UMR and everything. It's some days it's working, some days it's not in our benefits. But it's interesting to listen. I'm sorry I missed your first part of presentation, but I think it's very interesting. Thank you for sharing all of it.
Yeah, thank you for being on. And those are really some great points. Every plan, no matter what, is going to have hiccups, right? So we're going to go through bumps in the road. So whether it's with the KPCA and UMR and United Healthcare, or if it's with Anthem and another third party administrator, there's always going to be bumps in the road, even if you're fully insured, right? We hear horror stories all the time. The most important thing is to find what works best for you and your population, and just make sure that you're looking at all the options. Don't just discount self-funded and level funded because you're under 100 thinking you're too small. There are so many solutions that they have brought down market. Like I said, we have a 28 life group that's self-funded. They're not even level funded. And then if they have a really bad year and can't afford it, they'll just go back to fully insured, and they have the protections of stop loss for run out. So it's become quite easy to be able to maintain those plans nowadays. But the KPCA being with UMR and United Healthcare is an excellent option that all of you should be looking at. If you haven't already, like I said, go to Houchins and get those quotes through that plan, because they're the ones who you have to use them to quote. Associations like to work with specific brokers that know their plans really well, and that's important. And Houchins is the one that does that. So just make sure to give them a call, have them do the quoting for you. But hopefully this gave you guys some food for thought for some things that you all can potentially implement in your plan, look at. But don't just accept those double digit increases, and make sure that whoever you are working with is looking at all options for you. Even if it's not a good option, you want to know what's out there. You have a fiduciary duty to your plan and to your employees to make sure you're checking all the options that are out there. So hopefully this helps you kind of know what those are.
Christina, that was great. Thank you. Thank you so much. And for everyone on the call, if anyone would like to get in touch with our broker, I'm happy to help make those connections. I think everyone's got my email, but I also dropped it in the chat. And Christina, I did have a question. I was thinking throughout your presentation, this is such helpful information, and I know as part of the Best Place to Work survey, something that we discuss all the time is that sometimes organizations are offer benefits and the staff isn't always so familiar with how to use them, or how, like, what's even available to them. So I was curious if you have any recommendations or best practices on educating your team on the benefits available to them.
Yeah, so that's a struggle that every employer has. And so it's really important. I always feel like the more information employees have, the better, right? So if you're paying a substantial amount of that insurance costs for your employees, I would show that. If you haven't done the compensation statements before, those can be really powerful. I know a lot of people use, because I even like Houchins uses a program called Employee Navigator, or if you have an HRIS system that can spit those out, that's a really powerful way for them to see how much is my employer paying on our behalf versus how much am I having to pay. Because even if they're paying, the employees feel like they're paying a lot, when they see the full cost of that, it's very eye opening. Like, oh my goodness, because unfortunately, these premiums, especially on the health insurance side, those premiums I've seen up into 1,300 for a single right now. It has gotten so egregious, which is why I love having this talk, because there are options to, help with that. But making sure you have a really good benefit guide, whether it is, printed or online, something that spells out benefits really well. Have those meetings, in-person meetings. Having your broker come out and do those meetings is crucial for them to talk about, what we're facing in the market, what it could be like if they didn't have these benefits from the employer, and also going through how the benefits can help them and their family, because benefits is way more than just health insurance, right? It's medical, dental, vision, life, disability, your retirement plan, your PTO, all the things. So, making sure that you are having discussions with your employees. So, alongside your broker, your HR should be there talking about the things that your broker doesn't handle, like PTO. What paid days off do they get? Do they get holidays off? If they're primary care and part of the association, I'd say they're not working holidays. They have to remember that they get that. And if we're not constantly reminding people like, hey, don't forget, we get, 8 holidays off a year. You get this many personal days or whatever they are. We just have to remind people because our biggest challenge is attraction and retention. And so if we're trying to retain employees when they're going out and talking to another employer, you wanted them to have top of mind that, hey, they may not have as good of a PTO package. They may not have as good of benefits that I have over here at this employer. So it's important to do those in-person meetings. And I'll tell you, a lot of employers have gotten away from that because of COVID and they haven't gotten back into it. And it's important to do that because it's employees need an outlet to be able to talk to someone, to ask questions, especially if they're family planning or, if they're taking care of an elderly parent and you've got things like your EAP or travel protection through your LTD program. There's so many things out there, but yeah, I could go on and on about that. But communication's key.
Yeah, that's helpful. And if anyone else has another question, please feel free to chime in. But I think that that's such a key piece, right? The benefits are only as good as like what people know about and can use. And I guess as a follow-up and a somewhat similar question, are there any benefits that you recommend be included in like recruitment, thinking about marketing for opening positions, like any kind of like shiny, really attractive benefits that we want to like make sure that make the one pager, make the flyer for recruitment purposes?
Well, top of mind right now is always, health insurance, but I would say the things that are on the younger generation's minds are like tuition reimbursement, pet insurance. So if I haven't started family planning yet, pet insurance is a really great option. If I'm, just got out of school, I definitely have student loan debt that I have to, take care of, or if they want to pay for some classes to further their education. And if they don't want to do classes, like does KPCA offer any designations to get them? And I apologize that I don't know that ahead of time, but like can the professional development do with these types of organizations that are your members? What kind of further education can they get? Is there continuing education they can pay for? Things that they don't have to. Because the younger generations, they're definitely like, how is this going to help me instead of just a paycheck anymore, right? And just benefits. It's like, how is this company going to help me in my growth and not just what I can bring to the table? It's a two-way street now with the younger generation. And so I would definitely highlight those type of benefits if they're offering any, and any work from home opportunities. I don't know how feasible that would be with these types of organizations, but some things to think about for those.
I think that's really helpful. And I'm thinking about, I know so many of our organizations offer CE and, have systems set up that, they have certain amount of allowance that can be used for continuing education and conferences and maintaining their credentials. And also as nonprofits eligible for the PSLF. And I know that we promote that quite a bit. Our clinicians are eligible for National Service Corps. There's a lot of great loan repayment options going on within our member organizations. And, thinking about the younger generation too, like I think that it's a really cool selling point, especially part of like the community health center network that, as a community health center employee, you're kind of plugged into the state network, which is also part of a national network. And there's a lot of sense of community and mission driven there, but also, it's a recognized experience within a certain type of organization that I think is really employable and attractive to young candidates looking for that sort of direction.
Yeah, absolutely. You want buy-in from the people that you're bringing in. You want them to drink the Kool-Aid of your organization. And so for the members, they should absolutely highlight that they partner with you all. And here are the things that they can help them achieve to help further their education and their career. Because I feel like younger generations, and I apologize if I missed up by saying this, but I feel like what I've seen is that they want the fastest track to be able to have growth and to make more money. And how do I do that? And how do you keep them from jumping from organization to organization to achieve that, right? Like we want to keep them here. And the way that we do that is we get them these designations and help them further their career and move up within our own organization so that they're not hopping to the next thing to make more money.
Sorry, I'm coming in on the very back end of this. A lot of my employees were out today, so I've been trying to do everybody's job. But Christina, I think you had a really good statement there, and I think also instead of you get people to, as Ashley said, drink the Kool-Aid, or Christina, you said that as well, I believe, but um, it's also showing them what development looks like with that Kool-Aid, right? You don't want your Kool-Aid to be the same taste every day, like it should evolve with the times, and getting people who are mission driven, who want to add flavor to that Kool-Aid, right? But not just grow upward, but grow outwardly. Something I've noticed and I try to talk to people about is we can grow you upward as much as you want, but at that point you're a thin, long line. You're standing on shaky ground at best. I mean, yeah, you might get the accolades, but what happens when you hit a resistance, headwind, anything like that? What do you fall back on? You have nothing on the outside of you. And so growing outwardly to say, hey, I haven't had this experience yet. Let me check this experience out before I take that next step, because that next step is going to require me to have that experience. So I always like to say I would rather build somebody from scratch rather than a paper champion any day of the week. And that's really what I try to let people know as we bring them on. Hey, we might not have the 18 levels in between everything else, but we can give you 30 levels to the left and the right, front and back. We can grow your such a robust knowledge that when you are ready to take that next step, it's not even a step. It's more or less you just walked into your job. So promoting yourself outwardly as much upwardly, I think is a benefit as well. You just have to obviously provide that skill set, right? And provide that environment for them to be successful, and then really drink your own Kool-Aid with them, right? Lean into that.
Oh, I wholeheartedly agree. Definitely great points.
I'm glad that you asked that question, Ashley, too, about people's recall of you can design a wonderful benefits package that's beautiful and attractive and meets all the different demographics needs, which do change as you age, to Christina's point, for sure. But recall is a different thing when they're asked about it later, and they're asked their opinion. So to Christina's earlier suggestion of as a practical means of kind of jogging people's memory before best places, if you're going to participate, those total comp statements that Christina mentioned, that would be a great thing to do at the end of the year, because the survey takes place in early to mid-January, typically. So I've had some clients that did their total compensation statements in November, December timeframe to again prime that pump a little bit, to have it be a little bit more top of mind going into the survey season, so that they do recall this is the value of my benefits.
I may be showing my ignorance here, so excuse me. I know workforce development a little bit more than I know HR.
Sure.
But so for the total comp statements, if someone wanted to do that, is that something that the broker would help with, or is that something they would need to crunch internally, or would our team at the association be able to help with those that are on our plan, or?
Yeah. So Chase,
Go
do you
ahead.
want to tackle
Go
that?
ahead.
Okay.
Okay.
I
Or
could
I
just
can.
tell you. So typically brokers won't do it because we won't have all the information,
Okay.
because like we won't, we don't do anything on the retirement side. So we won't have your retirement information. But your HRIS system, or your payroll system. What were
Okay.
you saying, Chase?
Yeah, I was just saying, I was adding to that. Yes, you're right. It should be able to put those together for you. And and it should give you kind of a line item breakdown of each of those monetary values for everything that Christine just said, not just your health, but maybe your dental, your life insurance, and any kind of supplemental benefit they may have. And then it just shows it as a gross, your base salary plus all of those line items or all the benefit costs per year, and then a grand total at the end. So that is your quote unquote true worth.
Yeah.
And sometimes, to Christine's earlier point, it is one of those things that, you know, it can kind of make or break the difference for somebody wanting to jump ship to someplace else, because when they actually get to see their total salary in comparison to maybe another offer, or maybe the value of somebody else's benefits package, you guys could actually be paying them quote unquote more than a competitor, just because the value of benefits are far, far greater to that individual or that person's family situation or whatever, how many dependents they have on their plan. So, and then I honestly, Ashley, I've had CFOs of some of these smaller companies that have just sat down, we put all that together. You know what I mean?
Okay.
Like we just do it
Yeah.
per individual because they have a relatively small head count. Maybe they don't have an HRIS, so we'll just put them together and make them every year. But if you can automate it using an HRIS system, or if you're using a payroll vendor, that's perfect.
Okay.
Mm-hmm.
Well, that's good to know.
Yeah, and most of those systems will have an option. At least what I've seen, they'll have an option for total comp statements. So,
Mhm.
but the information that spits out is only as good as what you put in, as with
Correct.
any
Yes.
type of software. So, but they're just very powerful because, as an employee, I may make, say, $40,000 a year, but my employer may be paying $15,000 for benefits for me that
Mhm.
I don't even realize. So now I've gone from a 40,000 employee to a $55,000 employee. So
Mhm.
it's just really powerful. Like I always thought, going through my career, when I would see those, I was like, oh my goodness. And back then benefits weren't as expensive as they are now. So
Mhm.
it's going to be even more powerful now. And then if you add in things like just all the little things that people do, company events, and, like if you're supplying breakfast on Fridays, or, anytime you're adding all of those little perks, those need to be outlined, and then the big one I didn't mention was work-life balance and integration. Now integration's the new word. And that's really important to families, and, for people who are going through family planning, is how do I have that balance, and figuring out how to manage that internally. So,
The other benefit that I feel like we've got to mention here is that health centers, all of their providers are eligible for FTCA malpractice coverage, which is an
oh, nice.
incredible benefit.
Mhm.
And I don't know if Sherry or Desmond, if anyone has experiences that they want to share, but it essentially treats providers like federal employees if there is a malpractice suit, and is, covered as a provider of a health center. And I've spoke with some different like medical school classes about FTCA coverage, and it's always interesting whenever I'm giving the speech. It's happened a couple of times where the students, you can tell, aren't as interested, and their professors are like, this is a really big deal. The people that have been in the field a little bit more are more aware. So I'm curious, Sherry or Desmond, if there could be a way that we could find to like really show our providers how much benefit they're getting from that coverage too, as part of that comp package.
I think not only do I think that's a great added benefit, but I think the biggest thing that we could do from that perspective is have just data, right? Showing people how much it really costs, how much that will cost them out on anywhere else, and what that kind of looks like. Because I mean, I equate it to doctor bills. We all like, oh, doctor bills are expensive. We do know they're expensive, but we don't really know how expensive they are until that bill rolls in, and you're like, oh, that's more expensive than I initially thought. And something such as malpractice insurance, like, do you really know how much that's really going to cost you if something hits the fan? I
Right.
pray to God, that never does. But having that data and some of that factual based evidence, right, that says, hey, this is what we're looking at, and this is what you're covered for, and you don't have to pay for and don't have to worry about, like you said, because you're treated as a federal employee in that regard. So, I just would be having that conversation, and bringing those I guess data and those examples to the table. I don't know if anybody else has anything different.
Are there any final questions? I know we're almost out of time here. Not hearing any, but I appreciate everyone being here today. Chase, thank you for setting this up, and Christina, thank you for being here. This has been an awesome topic. I know we had a couple people join late, so Desmond, I'll make sure that you get the recording, and I'll send this out to everyone.
Thank you so much.
Of course, I appreciate your
And I'm
questions
sorry.
and engagement. Oh,
Ashley,
imaging, yes.
Ashley, yes, I'm so sorry. Late question.
Yes.
Christina, back to the beginning because I missed probably 15 minutes of your presentation, and I'm sorry for that. But can I ask the question, how long does it take really to get from to the self-insured system for organization when it's maybe 200, 300 employees?
So are you talking about the setup for like a self-funded or a level-funded plan?
Uh-huh. Mm-hmm,
Yeah,
mm-hmm.
so that's a great question. So it all depends on the broker and what relationships they have with their specific vendors that they use. So I can only specifically speak to mine and my experience. But we have, for a group of your size, we would have to have that in 60 days ahead of time for all of the sold case paperwork. So we would need a 60-day lead time, which is actually not as bad as what you would probably experience otherwise, but it's because we have built this product to be replicable. So
Mm-hmm.
all of our vendors are very used to it. So like with our product, it's very different because we rent the Anthem network and we use a TPA out of Louisville. And so they are very familiar with how our plans operate. And we have the same savings providers listed in there. So it's a very easy setup for them to just pull the trigger. So probably a 60-day lead time for getting it signed paperwork sent in. So we would need to be talking, like if we were to engage with you talking to put something like this in place, we're going to need like 90 to 120 days to start quoting.
Gotcha. Then if we're talking about 2026, we need to start talking right now.
Yeah, I mean, we're very strategy oriented. So when you're putting in a place like this, it's not your typical, we don't just look at 1 year snapshots and we race through open enrollment, right? So we're very strategy driven. Where are you today? Where do you want to be, 5 years from now? What do you want this plan to look like? And how do you want it to evolve over the years? But August would be, so let's see, October, September at the latest for a
Mm-hmm.
January 1st for us to start that conversation.
Gotcha.
So yeah, if we started a conversation now, that would be amazing. That would give plenty of lead time to get something like that moving. But we don't want to put anyone in a bad situation. So getting into like August and September, we could still pull that off for you, but we would want to do it earlier just to make it easier for you.
I hear you. Thank you so much, and I apologize
Yeah.
for such a late question, but I just more on a to-do list and how to get there fast.
Yeah,
Thank you,
yeah,
Christina.
absolutely. Thank you for the question. Yeah, this is not a sales presentation. This is for you guys to take this information for everybody who watches this video. This is for you to take this information and, share it with your broker. And we would love for it to be proprietary. But, like we really want Kentucky to thrive. We want Kentucky groups to thrive. If they can replicate things, like absolutely, if they can use those vendors, that's why I don't hide behind things like that, because there's enough business for all of us to go around. And it's important for us to make sure that Kentucky thrives.
Thank you again, and I believe we will have this presentation sent to us, right, Ashley?
Absolutely. I'll make sure that you get a
Thank you.
copy. Yes, thank you.
Thank you, Chase.
Thank you.
There we go. Okay, well, thanks everyone. I'll be sure to send this out. Big thanks again to Christina. This was a great presentation, and thanks to Chase for leading our collaborative and setting up all these great speakers. I'll send out this presentation and the slides, and if anyone has any questions, please don't hesitate to follow up.
Great. Thank you
Thank
all.
you all.
Thanks all. Bye.
Take care. Bye-bye.
Bye.